For most people, pouring a cup of tea is an activity that requires no effort or pain. For Stephen Papadopoulos, such things are a daily struggle.
I struggle with simple everyday things like brushing my teeth, shaving, tying my shoelaces, reading a book, typing on a computer, like just simple everyday things people take for granted. Even using cutlery I struggle with. I was 17 years old, so HSC time, and I got pins and needles. Normally people get pins and needles in their hands or their feet depending on how they've been sitting, but I got pins and needles over my entire body. I do mean everywhere. So they were doing tests on me, blood tests, putting electrodes in my hair. They were telling me to exercise more, eat less junk food, drink more water, breathe more, sleep more. They had no idea what was wrong. There were times when I couldn't feel certain body parts, like I'd sit there poking my arm, not being able to feel it, and questioning my own sanity, not knowing what was wrong. Finally in 2001, at the age of 22, I got all the symptoms I've mentioned all at once. And when my photos came back, I had white scars in my brain and spinal cord, which meant that I had MS.
Multiple sclerosis is a disease affecting the central nervous system. Currently, 23,000 people live with this in Australian society, and there is no known cure. Symptoms vary among individuals, but the most common can include things like fatigue, memory loss, pins and needles, loss of motor control, blurred vision, and more.
So I currently have constant sharp stabbing pains in both of my legs, my arms, my neck, my lower back, constant pins and needles in my hands and feet, and I have a burning sensation over my entire body. So I'm in pain 24/7, 7 days a week. It doesn't go away. And it's invisible, which makes it hard. I'm someone that's usually very happy and smiley and outgoing and social, so it's hard for people to think that someone could be in pain.
Luckily for Stephen and others like him living with MS, there are treatment options available. A recent paper published in the Medical Journal of Australia describes this age as a new era in the treatment of MS. Contributor to this paper and Sydney-based neurologist Dr. John Parrott says some treatments can be considered curative.
20 years ago there were no treatments, no legitimate or useful treatments available for multiple sclerosis. And year by year the number of different drugs that have become available to us has increased greatly. So now, as opposed to having 3 or 4, we have 9 or 10 available medications for the treatment of MS. For example, this recent drug in certain individuals might eradicate MS entirely for some people. So to give you an example, some people in the UK, about 150 people with MS, have received that drug and they're still in remission 10 years later.
As well as medicinal treatments, community centres are also available to help MS patients, funded by MS Australia. This includes things like health services and support groups. Practice leader for MS Care New South Wales, Robert McClay, says these options are an essential aspect of managing MS symptoms.
Probably the most important symptom management tool I think people can use is exercise. You see increases in energy levels. Fatigue's a big issue in people with MS, and even though it sounds a bit strange that exercise improves your fatigue levels, it does. So you do see a lot of people get more energy. They're able to their mobility increases. People that we use in that campaign relayed her story where before exercise she was using an electric scooter. And then after exercise, she was able to walk into our gym facility just using a walker rather than a scooter. So yeah, and that was because of the exercise.
While treatments have improved, the cause of MS is yet to be found. In the meantime, Stephen just hopes to spread an awareness of MS, as well as his own invisible symptoms.
And people are like, but you're young, but you look normal, but you're not in a wheelchair. So I think a lot of people have misconceptions of what MS is, and the average age of diagnosis for MS is actually 30, so it's a young person's condition. And yeah, it doesn't mean wheelchair, it doesn't mean walking frame, and someone that looks quite able-bodied and normal can have a chronic debilitating illness. It's one of the hardest things to try to keep justifying, especially when these symptoms are invisible.
Ashley Craig, UTS Journalism.